Hello, I'm Dr. Samih Tarabichi. I would like to welcome you to the Arab Health meeting that's going to be held at the end of this month. We're going to talk about Middle Eastern patient and total joint replacement. I had the opportunity to practice in the United States for a long time, and I have opportunity to work here in the Emirates over 25 years. We performed over 20,000 cases of total knee replacement, and I can tell you my experience shows that Middle Eastern patient is different, and this is what we're going to be talking about. I have multiple publications in the matter, but we're going to go into details about the differences and how you should approach total knee replacement in Middle Eastern patient. We look forward to seeing you in the meeting.